Treatment of sores. Introduction. Debridement is the process of removing dead and unhealthy tissue from a sore. Select true or false. Correct. Sometimes sores develop unhealthy tissue. It can cause problems with healing. Debridement is the process of getting rid of unhealthy tissue from a sore. Which of the following is used to treat infected sores? Choose one of the following options. 1. Debridement. 2. Silver dressings. 3. Antibiotics. 4. All of the above. Correct. Infected sores can be treated with debridement, silver dressings, and antibiotics. Sores need to be dry in order to heal. Select true or false. Correct. Sores need to be moist to heal correctly. A sore that is too dry can prevent healing, cause pain, and lead to infection. But too much moisture can also prevent healing, cause pain, and lead to infection. Which treatment might be used for a sore that is too wet? Choose one of the following options. 1. Absorbent dressings. 2. Hydrogel dressings. Correct. Dressings that absorb extra moisture may be used for sores that are too wet. Advanced treatments are usually the first treatments your doctor will consider for a sore that will not heal. Select true or false. Correct. Advanced treatments are usually used only if a sore does not begin to heal after treating necrotic tissue, infection, and moisture imbalances. Thank you for using Explain.